Aloha and welcome to the future of senior fitness. I'm your host, Myles, Master Trainer and Certified Senior Fitness Specialist. Today is part of our series of episodes on the physiological and anatomical considerations of aging. We will discuss the impact of aging on the musculoskeletal system. We will also review the common medical conditions that occur and how applying appropriate exercise recommendations can help these conditions. The musculoskeletal system is made up of bones, skeletal muscle, joints, tendons, and ligaments. These all work together to produce human movement. Age-related changes in the musculoskeletal system fall under two areas, structural and functional. Let's discuss the structural change that are found in each component of the musculoskeletal system, starting with the bones. Bone mass declines with age similar to muscle mass. Bone mass peaks around 30 years of age and then gradually declines. The cause of bone loss is multifactorial, including inactivity, changes in hormone levels, and improper nutrition. In regards to physical activity, the age-associated decline in muscular strength parallels loss of bone mass. Osteoporosis is a chronic disease characterized by a thinning and weakening of bones, and research shows a significant risk factor for osteoporosis is physical inactivity. Let's discuss skeletal muscle. Fat and connective tissue replaces muscle mass as it declines with age. Although not fully understood, the loss of muscle mass, size, and strength with aging is likely due to a reduction in physical activity. An active lifestyle helps to promote and maintain muscular health. Peak muscle fiber size occurs around age 20 for sedentary individuals before beginning to decline. However, physically active adults maintain their fiber size until around age 60. A decrease in individual muscle fiber size results in the decrease of whole muscle size. Regardless of activity level, it appears the number of muscle fibers decreases with age. In addition to a loss in muscle mass, the composition of skeletal muscle changes significantly. Finally, aging affects the joints, tendons, and ligaments predominantly due to structural changes occurring within the joint complex. Structural changes and the weakening of joints with age include micro-tearing and calcification. In addition, shortening of tendons and ligaments reduces joint range of motion by as much as 25%. With the weakening of cartilage, any injury may lead to a decrease in joint stability due to the lack of blood supply to the tendons, ligaments, and cartilage. Stability is an important fitness training consideration because it increases the ability of the kinetic chain to stabilize the lumbopelvic hip complex and joints during movement. Poor core stability increases the risk for unstable conditions in the upper and lower extremities. The core musculature activates and stabilizes the torso and produces forceful movements. This emphasizes the importance of core exercise for older adults and assists in the management of chronic pain issues. Let's turn our discussion to the age-related functional changes that occur in the musculoskeletal system. Structural changes that occur with bone tissue leads to very few functional decrements. However, older adults must keep bone loss in mind, especially adults who have osteoporosis. Structural changes in skeletal muscle lead to decrements in muscular strength, power, and endurance. A loss of structural integrity usually leads to a decrease in functional capacity. Muscular mass largely dictates muscular strength. The change in muscle composition with age relates to the loss of muscular power more than the absolute loss of mass. Structural changes in joint tissue may dramatically affect the functional fitness of older adults. Weakened joints of the hips and legs reduce mobility and significantly hinder an older adult's independence and functional capacity. Weaknesses and stiffness in these joints also increase the risk for joint injury and injuries that result from a fall. In addition to joints of the lower extremities, weaknesses in the elbow and shoulder may lead to decreases in the ability to perform physical activities that require upper body movement and flexibility. As a result, the ability to do normal daily activities becomes a significant challenge. Let's discuss the impact of physical activity, exercise, and fitness on the aging musculoskeletal system. Physical activity has a significant effect on bone health. Several studies demonstrate an association between physical activity and the retention of bone mass in older adults. Additionally, interventional studies show an increase in bone mass with physical activity, especially weight bearing and strength training, which adds a mechanical force or stress to the bone. Of course, dietary and hormonal considerations for postmenopausal women play a role in bone maintenance. Physical activity plays a vital role in reducing the effect of aging on most components of the musculoskeletal system. Research demonstrates that muscle mass, muscular strength, and muscular power are maintained to a greater extent in the physically active as opposed to their sedentary counterparts. Several training studies also demonstrate that previously sedentary older adults may increase muscle mass, strength, power, and endurance with strength and aerobic endurance training. Whether an older adult is active or not, training may significantly affect the health and functional ability of skeletal muscle. Research in the area of joint health largely focuses on the effect of physical activity and osteoarthritis, specifically in the relation to the hip and knee joint. There is considerable debate as to whether physical activity prevents osteoarthritis, while research actually shows an increase in the osteoarthritis as a result of overuse. In regards to secondary prevention of treatment, the Osteoarthritis Research Society International recommends aerobic, muscular strengthening, and water-based exercise as essential components of knee and hip osteoarthritis therapy. Today, we're going to review some of the more chronic common medical impairments that impact our musculoskeletal system. Let's begin with osteoarthritis. Osteoarthritis is characterized by the gradual deterioration of cartilage and bone within a joint. It is most commonly seen in joints that are load-bearing or highly mobile, such as the fingers, hips, knees, lower back, and feet. Healthy cartilage is able to function much like a sponge as it absorbs and releases synovial fluid as the joint experiences movement and pressure. In some people, cartilage is damaged through a variety of different mechanisms and is either broken away from the bones or becomes inflamed. This inflammatory process can disrupt the normal maintenance of cartilage and cause further breakdown. Eventually, with the loss of more cartilage, bones are exposed in the joint space. Bones do not respond well to direct contact and will form abnormal growths known as bone spurs, which can irritate and further damage the structures of the joint. The most common symptoms in affected joints include pain, inflammation, reduced range of motion, and grinding sensations upon movement. Risk factors for osteoarthritis include age, inactivity, obesity, a history of joint trauma, and repetitive joint motion. These problematic movement patterns will only serve to enhance the likelihood of osteoarthritis and result in a faster progression of the condition. In fact, research shows that older adults with knee osteoarthritis perform poorly on measures of functional performance and postural stability. Corrective exercise programs are vital for older adults who suffer from osteoarthritis to restore more optimal movement patterns and reduce stress on affected joints. There's no cure for osteoarthritis, and since pain is alleviated with rest, many of those afflicted tend to avoid regular exercise for fear of pain. Osteoarthritis is not caused by exercise itself. In fact, a lack of physical activity can accelerate the loss of healthy cartilage by reducing the movement of synovial fluid necessary to maintain tissue health. A recent study on aerobic and resistance exercises shows that older adults who exercise are effectively able to relieve arthritic pain and improve joint function. The most common treatments for osteoarthritis include anti-inflammatory medications such as aspirin, acetaminophen, naproxen, and ibuprofen. Exercise is safe for almost everyone. In fact, studies show that people with osteoarthritis benefit from regular exercise and physical activity. For people with osteoarthritis, regular exercise can help maintain healthy and strong muscles, preserve joint mobility, maintain range of motion, improve sleep, reduce pain, keep a positive attitude, maintain a healthy body weight, and correct posture. Today, my featured fitness guest is Eileen Min. Eileen is a retired school teacher. She has participated in the last 8 Honolulu marathons. Earlier this year, she was featured in a Star Advertiser article titled Fitness for the Ages. Eileen is a wonderful role model for all of us. 3 types of exercises are best if you have osteoarthritis: flexibility, strength, and endurance. Flexibility exercises can help keep joints moving, relieve stiffness, and give you more freedom of movement for everyday activities. Examples of flexibility exercises include upper and lower body stretching, yoga, and Tai Chi. All right, so let's go ahead and start off with some flexibility exercises. Eileen, let's go ahead and bring one knee up. And it's always good to keep the other leg bent so that your back is compressed. Okay, let's bring the other knee. Very good, and both knees up. And these are doctor recommended back stretches. Okay, so here's another flexibility exercise that we can use to stretch our hamstrings. And we're using this band today to help us do that. So go ahead, Eileen, bring it all the way up. You want to make sure your foot is straight up, and then down, up, and then down. So the key to this is anytime the knee bends, then you're coming back. It's probably, you're not flexible enough, so you want to make sure it's straight up and down. So Eileen, go ahead and turn to one side. Hold for 5 or 10 seconds, and then the other. Great. Okay, now for our shoulders, go ahead and place your hand over here. Good. So this is a good shoulder flexibility exercise, stretching exercise. And then the other side. Okay, and now for our triceps, we're going to pull back on the elbow. Great, and the other side. Okay, very good. Now, strengthening exercises will help you maintain or add to your muscle strength. Strong muscles support and protect joints. Weight-bearing exercises, such as weightlifting, fall into this category. Okay, we're going to demonstrate an upper body strength exercise for the chest. We have a stability ball here. This is a great piece of equipment that you can have in your home. You don't need to have a weight bench. This is just perfect for this type of exercise. So Eileen is using 2 5-pound dumbbells, and what we're going to do is she's going to bend at the elbow and then come back up and close up the exercise for her chest. Breathe in and breathe out. 2. This next exercise is a strengthening exercise for our lower body, but we're also going to include the upper body. So Eileen is going to be doing a bicep curl with a squat. So she's going to go ahead and go into a squat and curl at the same time. And that way we can be really efficient and do two things at once. Endurance exercises make the heart and arteries healthier and may lessen swelling in some joints. Try low-impact options such as swimming and biking. Okay, this is another example of an endurance exercise that's quite easy to do. All you need is a surface that you can put your hands on. And as you see, Eileen is moving her feet back and forth, back and forth. And you want to do this for at least 30 seconds. Try to work up to a minute or more. And the longer you can go, the more endurance you can practice. Eileen is going to be demonstrating an endurance exercise using a step up. And this is a simple piece of equipment that you can have in your home. You can also modify it by using something else as long as it's raised. And this is an endurance exercise that can help get your heart rate up. Remember, before beginning any exercise program, talk with your healthcare provider about the best activities for you, and if needed, seek a fitness professional to help you. Here's a quick tip. You may need to avoid some types of activity when joints are swollen or inflamed. If you have pain in a specific joint area, for example, you may need to focus on another area for a day or two. Next, let's turn our discussion to osteoporosis. Osteoporosis is a disease that weakens bones to the point where they break easily, most often in the hip, spine, and wrist. It is often called the silent disease because you may not notice any changes until a bone breaks. 10 million Americans have osteoporosis. It is more common in women, but men also have this disease. The risk of osteoporosis grows as you get older. At the time of menopause, women may lose bone quickly for several years. After that, the loss slows down but continues. In men, the loss of bone mass is slower, but by age 65 or 70, men and women lose bone at the same rate. The good news is there are things you can do at any age to prevent weakened bones. Eat foods rich in calcium and vitamin D. Include regular weight-bearing exercise in your lifestyle. Stop smoking and limit how much alcohol you drink. These are the best ways to keep your bones strong and healthy. Your bones and muscles will be stronger if you're physically active. Weight-bearing exercises done 3 to 4 times a week are best for preventing osteoporosis. Walking, jogging, playing tennis, and dancing are examples of weight-bearing exercises. Try some strengthening and balance exercises too. They may help you avoid falls, which could cause a broken bone. As I mentioned earlier, the best exercises for osteoporosis are weight-bearing exercises like walking, jogging, tennis, or even dancing. If you don't want to do those things, then you can do something like jump rope in your own home. Anything jumping up and down is a great way to help your bone density. Another great weight-bearing exercise is called the wall drill. And all you need to do is have some kind of surface to hold on to. So Eileen is going to begin with her foot up, and then for a count of 3, she's going to go 1, 2, 3, 1, 1, 2, 3, 2, 1, 2, 3, 3. Now let's discuss low back pain and spinal stenosis. 4 out of 5 adults experience low back pain at some time. Low back pain affects 80% of the adult population. Most back pain cases are due to self-limiting musculoskeletal condition, also known as low back pain and lumbar sprain syndrome. Lumbar sprain syndrome may occur after an unusual effort, such as lifting, but can often occur after a trivial effort, such as sneezing or bending over. This type of low back pain often resolves within 72 hours, but most patients with a history of acute episodes end up having additional chronic symptoms. If back pain does not resolve and is persistent for 3 months or longer, it is known as chronic low back pain. Research shows that chronic low back pain has a direct effect on postural stability, specifically demonstrated by a lower level of balance on one foot. As proper walking mechanics create the ability to balance on one foot, it is easy to see how the effect of chronic low back pain has on efficient walking, which can ultimately lead to a loss of independence for an older adult. It is shown that people who have chronic low back pain have deficits in motor skills, in addition to ineffective coupling of muscles in the pelvic region. Lumbar spinal stenosis is a specific form of chronic low back pain that is particularly common in older adults. It results from the narrowing of the spinal canal in the lumbar region, which causes the vertebral bodies and the intervertebral discs to compress the spinal cord and nerve roots. The most common complaint in people with spinal stenosis is consistent with entrapment of the sciatic nerve, pain and numbness in the lower back, buttocks, and hamstring. Spinal stenosis may be present in the cervical and thoracic spine and may affect other locations of the body, including the arms and trunk. Conservative treatment options for lumbar spinal stenosis include anti-inflammatory medication, epidural corticosteroid injections, and lumbar support braces. Therapeutic exercise is an effective treatment strategy for this condition. People who do not find relief with these treatments may require surgery, which includes a laminectomy or spinal infusion, where adjacent vertebral bodies are fused together using bone grafts. Exercise for low back pain is an effective mode of treatment. Research demonstrates the effectiveness of proper training for the relief and reversal of chronic low back pain. Stabilization level core exercises, which involve little or no movement of the spine, have proven efficient for strengthening of the core stabilizing muscles and pain relief within 1 week. Strengthening exercises for the spine are effective in increasing strength and decreasing chronic low back pain. If we have low back pain, stabilization exercises with little or no movement in the spine are best. Eileen is going to demonstrate a floor bridge by coming up, squeezing her glutes, and drawing her belly button into her spine and down. Up again, holding for 2 seconds, then return. And one more. That's an example of a floor bridge. Another great stabilization exercise for our transverse abdominis is the opposite arm leg reach. Eileen is going to demonstrate by lifting one arm up and the opposite leg up at the same time, extending and elongating her midsection, squeezing the glutes at the back, and keeping her hand and head forward. This is a wonderful exercise to do for stabilization for the spine, and this is called an opposite arm leg reach. Here's another example of a stabilization exercise for the spine called a prone isometric, or also known as a plank. And Eileen will be up on her elbows. Make sure her elbows are out and not in so her diaphragm isn't involved. Her glutes are going to be up tight, and she's going to be squeezing her midsection up. And she's going to hold for 30 seconds or more, working up to a minute, and so on and so forth. This is an example of a stabilization exercise for our obliques and to stabilize our spine. It's called a side plank or side isometric ab exercise. Eileen is going to be coming up and holding this position for 10 seconds, making sure that her arm is supporting her shoulder. Finally, let's discuss shoulder impingement. Shoulder impingement is caused by pressure on the supraspinatus tendon by the scapula as the arm is lifted at or above shoulder height. As the arm is lifted, the acromion of the scapula presses on the surface of the rotator cuff tendon. This limits movement and causes pain and weakness. Shoulder impingement is common in older adults due to the increased likelihood of thoracic kyphosis and protracted scapulae. These anatomical positions serve to decrease the subacromial space through which the supraspinatus tendon can pass on its way to the humeral insertion. The compressed space leads to soft tissue injury. These issues are traced to a number of different factors, including repetitive lifting, shoulder trauma, or bone spurs from osteoarthritis. In advanced cases, shoulder impingement can lead to the development of frozen shoulder, where virtually all movement at the shoulder causes pain. According to the American Academy of Orthopedic Surgeons, treatment for shoulder impingement can include a number of strategies, including rest, anti-inflammatory medication, physical therapy, and surgery. Until next time, this is Myles Diaz wishing you the best in health and reminding you that health is your only wealth.